We'll start a round of questions if we can. And you talked about the press release April 19th. You've acknowledged also that there's about I think it's 1,500 mental health staffing vacancies. It could be more or less. And your staffing, your testimony today talks about maybe hiring more than 1,900. So what I'd like an answer is, I know you're going to try to fill the 1,500 vacancy that exists. You're going to add additional 1,900 plus staff. The question is that correct? Then a couple other things. How quickly do you think VA can hire the additional staff? Where are you going to put the additional staff? And how will you be able to measure the impact that they will have on improving care?
Mr. Chairman, let me just make an opening statement here, and then I'm going to call on Ms. Annie Spisak, who does the recruiting and retention personnel work for us, because you're asking to see what tools we have and what our expectation here is. We think that we'll get most of that done in the next 6 months, but some of these specialties are difficult to recruit, and I would, be honest with you, I'm not sure I can pin a date when all of them will be in, but the vast majority of the work will be done in the next 6 months. Some of this may carry over into the second quarter of FY13. Let me call on Ms. Spisak to talk about the process here.
Thank you, Secretary. Sir, I would say that we have a fourfold strategy to recruit and hire the mental health professionals that we need in VHA. The first part of that strategy is to have a very robust marketing and advertising campaign to do that outreach to mental health providers and professionals, that by the use of USA Jobs, using social media, getting all of those vacancy announcements posted to specialty sites and job boards. The second part of that is using our national recruiters. We have 21 dedicated healthcare recruiters, and they're very involved with the VISNs and the medical center directors to recruit those hard-to-fill positions, especially our psychiatrists and our psychologists. Thirdly, we're going to recruit from our active pipeline of trainees and residents. VHA has a very robust training program, and they're an integral part to filling that pipeline of our workforce. And fourthly, we're going to ensure that we have complete involvement and support of VA leadership.